Let me guess and read your mind. In my thoughts, you think that when we have kidney problems, then we feel pain only in the kidneys, right? But the reality is totally different from what no one supposes, because when you have any kidney problems, then pain wanders to places you would never expect. You might feel a sharp ache in your side or even a dull throb in your groin area that feels like a muscle pull. This confusion often leads people to treat the wrong issue, while their kidneys continue to struggle without any direct help. I want to help you by giving you a map of exactly where your body hides these signals, so you don't get fooled by ghost pains. The T10L1 pathway. To understand why your kidney pain is currently masquerading as a leg cramp or a backache, we have to look at the wiring of the human body. This is the foundation of the ghost pain phenomenon. Most people assume that if an organ hurts, the brain will point directly to that organ's location. However, the human body's internal mapping system is surprisingly vague compared to our external senses. This is due to the difference between somatic and visceral nerves. Your skin is packed with somatic nerves. These are highly specific. If a mosquito bites your left elbow, your brain knows the exact coordinate. The kidneys, however, rely on the autonomic nervous system, specifically the renal plexus. These nerves are visceral, meaning they are designed to monitor general pressure and chemical changes rather than pinpoint locations. When the kidney is under stress, whether from an infection, a stone, or a cyst, it sends a distress signal that travels back toward the spinal cord. And the ghosting happens because these kidney signals enter the spinal cord at the T10, T11, T12, and L1 vertebral levels. This is a very busy neural intersection. These are the same levels where the sensory nerves from your skin, your lower back muscles, and your groin also enter the spinal cord. In medical terms, this is called convergent projection. Because your brain receives thousands of signals from your back muscles every day and almost none from your kidneys, it develops a habit. When a loud distress signal arrives at the T10 level, the brain, trying to make sense of the data, assumes the signal is coming from the area it knows best, the skin and muscle of the lower back and flank. This is why you might reach for an ice pack for a supposed muscle strain when, in reality, your renal pelvis is inflamed. Furthermore, the kidneys are retroperitoneal, meaning they sit behind the lining of the abdominal cavity, tucked right against the deep muscles of the back. Specifically, they rest against the psoas major and the quadratus lumborum. When a kidney becomes swollen, it physically irritates these muscles. This creates a sympathetic spasm, where the muscle tightens up in response to the organ's distress. At this point, you aren't just feeling referred pain, you are feeling an actual muscle cramp caused by an organ that is crying for help. Understanding this neural crosstalk is the first step in realizing that the pain in your side isn't always what it seems. Zone 1. The flank and mid-back. If you've ever woken up with a deep, gnawing ache in your side and thought, "I must have slept wrong," you're in the exact situation I'm talking about. And this area, the flank, is the primary ghosting ground for kidney distress. But here is the trick. The kidney isn't just in your back. It's interacting with your entire skeletal structure in a way that can make even a seasoned athlete think they've slipped a disc. To tell the difference, we have to look at the renal capsule. Imagine your kidney is wrapped in a very tight, very sensitive saran wrap. The kidney tissue itself actually doesn't feel much pain. You could theoretically poke the inside of a kidney and feel nothing. But that outer wrapping? It is loaded with stretch receptors. When a kidney gets inflamed or a stone blocks the exit, the kidney swells. And that saran wrap, the capsule, stretches tight. This creates a sensation that is deep, boring, and heavy. Now, here is how you and I are going to figure out if it's a ghost or a real back injury. I call it the position test. If you have a traditional back injury, like a pulled muscle or a herniated disc, the pain is mechanical. That means if you lean to the left, it might hurt more. But if you sit perfectly still in a recliner, you might find a sweet spot where the pain vanishes. Kidney pain is a different beast entirely. It is non-mechanical. It doesn't care if you are standing, sitting, or doing a handstand. That deep, heavy throb stays the same because the pressure inside that renal capsule hasn't changed. If you find yourself pacing around the room at 2 a.m. because you literally cannot find a comfortable way to sit, that's a massive red flag that your kidney is the one pulling the strings. We also have to talk about the psoas sign. Now remember how I mentioned the kidneys sit right on top of your deep back muscles? The psoas is a massive muscle that connects your spine to your legs. It's what you use to lift your knee. When a kidney is infected, pyelonephritis, it becomes hot and swollen, irritating the psoas muscle directly. This can cause you to walk with a slight limp or feel like your hip is stuck. Many people spend hundreds of dollars on massages or physical therapy for a tight hip, when the reality is that the muscle is just reacting to the toxic neighbor sitting right on top of it. If your mid-back feels like it's being squeezed in a vice and no amount of stretching makes it pop or release, stop looking at your spine and start looking at your hydration and kidney health. The ghost isn't in your bones, it's in your filtration system. On zone 2, the abdominal mimic. Imagine you're doubled over, clutching your stomach, convinced that last night's spicy takeout is finally seeking its revenge. You're scanning your brain for signs of food poisoning or maybe a terrifying burst of appendicitis. But here's the plot twist. Your digestive tract might be completely innocent. Welcome to the abdominal mimic, a high-stakes game of hide and seek played by your kidneys from behind the scenes. Technically speaking, your kidneys are retroperitoneal. This means they live in the basement of your torso, tucked behind the sleek, clingy lining of your abdominal cavity called the peritoneum. Because they are pressed so tightly against this lining, any drama happening in the kidney, like a sudden blockage or a skyrocketing infection, vibrates through that lining like a drum skin. And this creates a phenomenon called peritoneal irritation. To your brain, it feels like the pain is coming from the front-facing organs, like your stomach, your gallbladder, or your intestines. If the trouble is in your right kidney, it can perfectly imitate the sharp, stabbing warning shots of an inflamed appendix. If it's on the left, it often masquerades as diverticulitis or a bad bout of irritable bowel syndrome. I've seen people try to treat this with antacids or stomach flu remedies for days, while the real culprit, a silent kidney struggle, is actually the one pulling the alarm. The secret to catching this mimic is looking for the nausea pain sequence. With typical stomach issues, you usually feel nauseous before the heavy pain hits. With kidney-based abdominal pain, the agony usually strikes first, and the nausea follows as a secondary reaction to the sheer intensity of the internal pressure. It's a systemic system crash rather than a digestive one. Also, keep an eye out for bloating without a cause. When the kidneys are distressed, they can cause a reflex called a paralytic ileus, where your intestines actually slow down or stop moving entirely because they are scared by the inflammation happening right behind them. Your belly gets hard and distended, but the problem isn't what you ate, it's how you're filtering. Don't let the ghost trick you into treating your gut when your kidneys are the ones begging for a lifeline. Zone 3, the groin and inner thigh. Now, let's talk about the most famous road trip in human anatomy, the descent of a kidney stone. If you've ever felt an electric-like tingle in your inner thigh, or a heavy pulling sensation in your groin that you swore was a sports hernia, you've met the ureter trek. This is where the kidney's ghost pain stops being a dull ache and starts becoming a lightning bolt that travels south. The ureters are the long, slender tubes that act as the highway from your kidneys to your bladder. They aren't just passive pipes, they are muscular, living tissue. When a tiny stone or even a piece of sludge gets stuck, the ureter goes into a frantic series of spasms to try and push it through. This is where the genitofemoral and ilioinguinal nerves enter the chat. These nerves are the wiring for your pelvic floor and your upper thighs. Because they run almost exactly parallel to the ureters, the brain gets the signals totally crossed. In men, this is often a terrifying ghost. You might feel a sharp, agonizing squeeze in the testicles, leading many to rush to the ER, fearing testicular torsion. In women, this pain often mirrors ovarian cysts or deep, agonizing menstrual cramps that seem to come out of nowhere. It's a localized emergency signal that's being broadcast to the wrong station. But here is the insider tip to spotting this ghost: migratory pain. This is the only type of pain that literally walks down your body. If you felt a sharp pain in your side 3 hours ago, and now that pain has vanished, but you have a pulled muscle feeling in your groin, the ghost is moving. It's the stone or the pressure wave traveling down the L1 and L2 nerve pathways. Another weird signal: on the inner thigh, buzz. Because the nerves involved also supply the skin of your upper inner thigh, you might feel a patch of skin that is hypersensitive to the touch or feels like it's vibrating. You might find yourself rubbing your leg, thinking you've strained an adductor muscle at the gym. In reality, your ureter is just working overtime. This isn't a pull, it's a pipe issue. When the pain reaches this zone, it's a sign that the kidney is trying to flush the problem out of the system. Understanding this pathway is the difference between icing a leg that isn't injured and getting the hydration you need to clear the real blockage. Zone 4, the shoulder blade and diaphragm. Ever had a sharp, catchy pain in your shoulder blade that makes you think you've sat at your computer for too long? It feels like a knot that no foam roller can reach. You might try to stretch it out, roll your neck, or blame your pillow, but you're actually witnessing the most sophisticated optical illusion the human body can perform. This is the phrenic nerve high wire act. Here's the setup. Your kidneys are the upstairs neighbors to your diaphragm, the great sheet of muscle that powers every breath you take. When the top of the kidney, the upper pole, becomes swollen, perhaps due to a hidden cyst or a silent abscess, it begins to poke and prod at the diaphragm like an annoying neighbor banging on the ceiling. The diaphragm is wired directly to the phrenic nerve, a neural superhighway that originates way up in your neck at the C3, C4, and C5 levels. Because your brain is used to receiving signals from your neck and shoulders through those same C3 to C5 channels, it completely ignores the kidney's involvement. It simply tells you, hey, your right shoulder is killing you. This is a phantom of the highest order. You'll know it's a kidney ghost if the pain gets sharper, specifically when you take a deep, belly-expanding breath. This isn't a desk job injury or a gym strain. It is a pressurized organ pushing on the breathing pump of your body. If you're rubbing your traps or your scapula, but you also feel a weird sense of fullness under your ribs, the ghost isn't in your muscles. It's a signal being beamed up from the basement to the roof. The How It Feels Guide. If pain had a language, kidney pain wouldn't be a whisper, it would be a chaotic, unpredictable symphony. As to catch the ghost, you have to learn to decode the texture of the sensation. We aren't just talking about hurting, we are talking about renal colic verses. Nephralgia, two very different villains in this story. Think of renal colic as the storm. It comes in waves. 1 minute you are fine, and the next you are doubled over in a white-knuckle grip of agony. This is the sound of your internal plumbing, the ureters, trying to squeeze something out that doesn't belong there. It's a rhythmic, pulsing scream. On the flip side, nephralgia is the shadow. It's a heavy, dull, relentless throb that never goes away. It feels like someone has tucked a lead weight inside your flank. This is the hallmark of a stretched renal capsule, the kind of pain that feels deep in your soul, not just on your surface. To settle the debate once and for all, doctors use the Murphy's Punch, or CVA tenderness test. Imagine sitting upright while someone finds that soft spot on your back where your last rib meets your spine. They place a flat hand there and give it a firm, percussive thump. If it's just a back muscle issue, it might feel like a dull thud. But if the kidney is the culprit, that thump will make you want to jump out of your skin. It's an electric reaction that confirms the internal pressure is at a breaking point. It's the ultimate way to unmask the ghost. When the how of the pain feels like a crescendo rather than a steady line, your body isn't just complaining. It's sounding a 5-alarm fire. Beyond the pain, red flags. When the ghost pain stops being an elusive ache and starts bringing friends, you've officially entered the danger zone. And this is where your kidneys stop sending subtle phantom signals and start sounding a full-scale systemic siren. We call this the internal alarm clock, and it shows up in ways that have nothing to do with your back or your groin. First, look for the toxic trio: hematuria, pyrexia, and dysuria. If your back pain is suddenly accompanied by urine that looks like iced tea or a sunset, blood, or if you're shivering under 3 blankets while your thermometer spikes, fever, the masquerade is over. This is a direct signal that the renal tissue is under siege. But the real ghostly symptoms are even weirder. Have you noticed a metallic, penny-like taste in your mouth? That's not a dental issue, it's uremia, a buildup of waste products your kidneys failed to filter, now literally bubbling up in your saliva. Then there's the pruritus, or the inexplicable itch. If your skin feels like invisible ants are crawling under the surface, but there's no rash in sight, your kidneys might be struggling to process phosphorus. These aren't just random glitches, they are the final pieces of the map. When the ghost pain joins forces with a change in your bathroom habits or a strange chemical scent on your breath, it's time to stop guessing and start acting. Your body isn't just haunted, it's asking for an immediate rescue mission. Thanks for being with me across the journey. If this map helped you unmask your ghost pain, then don't go without pushing the subscribe button, drop a comment with your thoughts, and like the video to help others stay informed.